Welcome back, everyone. We are going to get started here with our next session, Make Your Voice Heard, presented by Dr. Nita Lee, Gynecologic Oncologist, University of Chicago Comprehensive Cancer Center, who is also a very good friend to this organization and truly understands the unique partnership, not only of the patient and the physician for better outcomes towards survivorship, but also being allies when it comes to patient advocacy as well. So the next voice you'll hear will be from Dr. Nita Lee.
Good afternoon. My name is Dr. Nita Lee, and I'm a GYN oncologist at the University of Chicago. I was very excited to be able to speak today at the Cervical Cancer Summit by Survivor. This is a really important organization, and as you have experienced today, a really tremendous way to really make your voice heard, both for you and your community. So I'm going to touch a little bit today about being an advocate in a lot of different realms, both for yourself and for others. I also serve as the Assistant Director for Community Outreach and Engagement. So I think this is another role of understanding how much our role as oncologists, partnering with our patients, can really make a difference in terms of community outreach and education. So I'm going to start from sort of the beginning of building up your medical team, because I think before you can really think about advocating for others and the larger social network that you belong to, you really need to think about how are you advocating for yourself. So one of the things is really building your medical team and understanding who's a part of your team. And this may really range. Obviously, as a GYN oncologist, I take care of a lot of women who have cervical cancer, but sometimes patients who have cervical cancer also have a medical oncologist or a radiation oncologist. Oftentimes, the team is bigger than just the one doctor and includes people like a physician associate or PA or nurse practitioner, nurses involved with chemotherapy or follow-up care, as well as very important other providers such as social workers, physical therapists, nutritionists, and palliative care or symptom management specialists. So I put this out there to kind of say like, hey, who is a part of your medical team and who is going to be the person that you've sort of developed the closest relationship with? And it may not be the same thing for every person. And I think it's also really important to understand that who is more central for your needs may change over time. For example, during initial diagnosis and initial discussions about treatment management and about choices that we're making, I may play a much larger role in my relationship with my patient and kind of direct contact, but this may change over time when somebody moves into sort of more survivorship and aftercare and really develops, for example, a really strong relationship with their physical therapist. But I think trying to think through how do you build that team and do you have all the elements of that team available to you is a really important first step. Also, the idea of social support. This is something that gets a lot of attention. And obviously, when someone has a cancer diagnosis, there's a lot of people who want to know what to do and how they can help, and really understanding how you can best utilize the people who love you and want to support you around you as well. So, this includes sort of building up, between people who have partners or caregivers, family, friends. Online communities have become more and more important, especially during COVID, especially, for example, through Survivor. Local support cancer centers are often a really good way to connect with people who are going through similar circumstances, even if it's not the same cancer specific site. And they also often will have sort of GYN specific cancer groups as well to think about. A lot of the resources that these cancer centers can have, including things such as massage and nutrition and therapy, are really important to kind of link into so that you're aware of what's even out there. And then, of course, there's the support that you gain from fellow survivors or mentors. And this is also really important because you can be linked into them through various different ways. Sometimes it's through your own provider's medical office or medical care team where they've had an established mentoring program. Sometimes it's online through organizations such as Survivor. And I think it's really important to think about that many of my patients have told me that it really surprised me, like with whom they felt most supported. So they thought it would be their partner, but it ended up being a friend they had not connected with for a while. And understanding that you may have different people in your lives who may serve different needs. And that also sometimes it can be very frustrating because patients have told me that not everyone, not all cherished loved ones can provide what you need at different times. And really it's realizing that this may be depending on where you are on your cancer journey, it may be time where some people sort of, you kind of distance a little bit, and some people get brought into your social support network, and realizing that this may be sort of a flux, and that's okay, because you still get to be in charge of how you want that to play across. When you're at the doctor's office, this is really where we want you to advocate for yourself. As a someone who is in an academic center where we have residents and students and fellows, a lot of what we're trying to do is really trying to focus on, like, how do we put the patient-centered perspective at the center of our office visit. And so there's a lot of techniques that we talk about with our trainees, in which we try to be in practice with, to really establish a really good patient and provider relationship. And again, this is really the trust of that type of relationship, and finding that really good niche with your provider is a really important part of how you can start to advocate for yourself. This may include the oncology team. It may be a trusted primary care provider or other provider who's been in your life before, or it may be somebody new that you've met during this time period. Thinking about making sure you feel like you have somebody who's in your corner from your provider team is really important. And sometimes this actually does mean getting a second opinion or meeting with different people to be able to provide that niche for you. One of the things that's really important is to kind of establish with your team, how are you going to communicate with them? Is this via phone and messages and them calling you back? Is there an opportunity for some type of my chart or direct communication, these emails through the medical record system? Those are really important things, so that you know what your expectations are. Is there a PA or nurse practitioner team that can be more easily available than your physician? Various different things are really important, so that you know what to expect and how to get a hold of people, both for urgent things as well as non-urgent things. And this can make you feel a little bit more confident that this is really a team approach to your cancer care. And that's how you should feel. When I think about, what we think about, how do you advocate for yourself? We think about sort of preparation. So thinking of really basic things, which sometimes people do already, but just to kind of review, like thinking about a list of questions. If you have a doctor's visits coming up, if you're on treatment, or if you're between treatment, or maybe you're only seeing everybody once every 6 months, still thinking and taking that time to think about, what are the questions that I have? What are the things that I really want to be able to discuss today? Sometimes this involves a little bit of background reading, or even viewing of videos, because everybody learns in different ways, to kind of say, hey, I'm really interested in this topic. Like, what can I learn, and what questions can these background information raise for me? Not because you may get all of the answers, but at least it'll start to kind of have a little bit of exposure to the vocabulary. And I think this can be a really powerful way to discuss things with your doctor. And I think it's important to make sure, obviously, that these are websites and online materials that are vetted and are from sort of reliable sources. And I'm sure we're happy to provide that as well, in terms of good resources for you. Sometimes it's really important to kind of talk through with your support people, whether it's like your husband, your sister, your partner, kind of almost like a practice run. Like, what do I want to get out of my doctor's visit today? What do I want to talk about? Are there issues that, you've seen me thinking about that you want me to raise? It's really important to kind of have that in mind, so that you know exactly, you have some priorities when you're going in there. During the visit, I think it's always really important to potentially have somebody who's a note taker. Obviously, during COVID, we've had to change sometimes a lot of these restrictions on visitors, which have been really difficult. You can always ask what the most latest restrictions are, or if there's an ability for somebody to come with you. And if there's not, whether or not you want to record the conversation that you're having, or even have somebody there on like a video visit or FaceTime. And so I think these are all things that many medical providers are getting very adept at, to make sure that you have the person that you want with you. The note taker is particularly important, because I think just another pair of ears is just very important to kind of hear and to document, and to be able to kind of go back to those notes as well. Making sure you're asking questions, and having the physician or provider clarify. If you're not understanding what is being said, it is completely in your right and prerogative for the provider to do better, and to be able to explain it in a different way. And I think that's really important, because a lot of times patients are sort of fearful to kind of interrupt, or fearful for like feeling like they feel like, oh, I should know this already. But again, I think it's really important. One of the models that we teach actually medical students is something called the teach back model. well. So really asking our patients to say, hey, I went over all of these things, and now I'd like you to kind of hear what you understood of what we talked about. And so sometimes if your physician or provider is not jumping into that and kind of having you teach that back, you can actually be really your own advocate and take that into yourself, right? To say, hey, what I hear you're telling me about my options are XYZ. Is that what you're telling me? And how can you better clarify that? This can be really important to be able to, to really almost like signal to your doctor that you really want this back and forth type of conversation, and that you really want to take a deep dive into things and make sure that they are actually really articulating what they want to say, and they're being very clear. Asking for handouts and for trusted online resources is also something really important. Knowing which way you process information best is a really important way to think about advocating for yourself as well, because you know what type of learner or what type of system works best for you. And so I think that's really important as well, because there's a significant amount of resources that are available, but I think the time constraints of a medical visit, often sometimes we don't even get everything that we want to get across. And then after the visit, thinking about reviewing your notes. Was everything covered that you wanted? Is there anything that you want to clarify or follow up for next time, or for another way of reaching out to your doctor? And that's really important to kind of think about just the summary of it. So I'd like to talk a little bit about this concept of shared decision making. And I think it's really important because this is, again, a concept that we often actually go through with ourselves and with our trainees. And so as a patient, it's really important to say, this is the kind of model that may work for you. There's a lot of different ways decisions are made, and a lot of this sometimes can depend on like where you are in your cancer journey. Sometimes there's less decisions to be made at the beginning, sometimes there's more decisions at the beginning and less during surveillance, but each time really thinking about like what your style is and what suits you best. So traditionally, things have been sort of going from clinician to patient with sort of a paternalistic or one-way information. So you have information and recommendations, and they're delivered to you as a patient, and then you absorb them and you act those out, or you go through whatever treatment is recommended. Um, we really want to provide informed medical decision making. So the information that we give to our patients, we really want them to be able to understand it. So making sure that we are sharing this with you in a way that you can understand. But at the same time, this one-way street is really not the way we want decisions to be made, and it isn't necessarily optimal patient care. So we know a lot about the evidence of what cancer care may be, or what the recommendations are for different types of care, whether it's for initial treatment or recurrence. But we really need to kind of put you at the center and really kind of thinking about, how do we do that, and how do you become an advocate to do that for yourself as well. So thinking about information and recommendations, but also thinking about what are your specific values, preferences, and questions and concerns. And so realizing that you actually have such a big component to provide to this overall conversation is kind of the center of shared decision making. This idea that we're bringing in patient-centered communication and evidence to really kind of create this like space for this. This is an approach called SHARE, which is the essential steps of shared decision making. And I think, again, this picture here is really from the perspective of a provider, but I always like to flip the script a little bit and say, as a patient, how are you participating, and maybe even how are you leading your provider to really think about shared decision making? So number one, seeking patient participation. So this may be something that your provider does naturally and really comes to them, and that's their style. Or it may be something where you have to push a little bit and say, hey, I really want to give you my input, or I'd like to really, be an active participant in making these decisions. Number two, helping explore and compare treatment options. And this is very critical in terms of, for cervical cancer initial treatment, sometimes it's about decisions about surgery, types of surgery, sometimes it's decisions about fertility sparing options, and sometimes it's decisions about chemotherapy and radiation. There's obviously a whole range of options that are often laid out, and we never want this to be sort of a menu of items and putting the onus on the patient to kind of make all of these decisions by yourself, but really understanding our role as a physician is to kind of help you really lay out the pros and cons of all of the different treatments, and you actually being able to tell your doctor, I want to compare these options. Like, what do you think the benefits are? What are any downsides? Even asking them, are there any other questions that I haven't asked you? Assessing patient values and preferences. And this is really important because I think that patients sometimes, in my experience, can be they don't want to necessarily always express their values and preferences, especially with a new diagnosis, or especially when we're thinking about, scarier times where you're more vulnerable, and you may want your doctor to be able to tell you like, hey, I just want you to tell me what to do, right? And that's okay, but we should still be gathering from you what your preferences are, what your wishes are, what are the things that you value, both in terms of perhaps like, other competing things that you have going on, other things that you're balancing, being a parent, work, jobs, all those kinds of things are really important for us to take into consideration when we're planning treatments, or when we're just thinking about decisions about follow-up. Number 4, reaching a decision. So kind of like really as a mutual party, like group, really making that shared options and then evaluating that decision. So really kind of thinking about like, is this decision still right for me? Obviously, when you're starting on a treatment plan, we want that to be completed and, be holistic, but thinking about other options, such as maybe deciding about when to get a CAT scan, or deciding about other side effects and how to manage them. These are all elements of it. And it's really important to kind of think, we always try to train our physicians, but I think it's really great to kind of think about yourself as being like, hey, I'm going to be a really trained patient advocate for myself. So there's many pathways to becoming an advocate. We've spent a few minutes talking about being your own advocate at your doctor's office and in the medical system, but thinking about being an advocate to the outside public. This is a generous undertaking, and I think it's really important to know that it can be a really important way of finding meaning and purpose, especially after a cancer diagnosis that can be so life-altering. You do not owe anyone your most vulnerable self all the time. I tell patients of mine who've gone on to become advocates that just remember that there's a balance between what you can give and when you want to be vulnerable, and when you can kind of create your own personal story and narrative because you are the expert, but really kind of keep parts of that for yourself as well. And so this is a fine balance. And I think Survivor, obviously all of the experts here and all of the mentors here do an amazing job of this type of a balancing act. An education advocate can be somebody who's using a wide range of platforms. So social media, video, written, sharing good information, important by vetted sources. This could mean education and discussion with friends, families, acquaintances about cervical cancer screening or HPV vaccine. It can be more formal speaking events at sort of either a local social network, at a church, at at your own hospital, perhaps. Partnering with your medical team may be a really important way to do this. Sometimes we have providers who are like, hey, I have these events. Would you like to come and talk with me? Or sometimes you can be the person who instigates, like, to your doctor, hey, I really want to do an event at XYZ, and can you come with me? And you'd be really surprised, especially in the GYN oncology community, how valuable that can be as a paired team to be able to do this. And I think that that's been some of my most really important partnerships have been with patients who've really either taken me somewhere where we can speak together, or I've taken them somewhere. And I think those types of really sharing that type of partnership with others to evoke change can be incredibly powerful. There are a lot of public health efforts around cervical cancer and HPV vaccine. So this may even be something that your local medical team or hospital can help you hook up with as well. And then obviously Survivor is fantastic resources. Mentoring is sort of an individual sharing of your story or your experience and being someone else's support. This requires some degree of balance. Sometimes mentoring happens sort of on the fly by somebody who you meet during your radiation treatments, or someone who's in the infusion suite, and kind of just sharing informally some stories and kind of tips and different things like that, so that you don't feel alone. And can be really important both as a mentee and a mentor. If you're going to be embarking on kind of a more formal mentoring program, thinking about the training that you may receive about communication, about privacy, and again about how the role of a mentor may not be just sort of sharing only your story, but really being there as a listening partner. And that can be a really fine balance to juggle. So I do recommend that there are a lot of really great mentoring programs and training for this. Some of them obviously through Survivor, some of them through different other GYN cancers. Immerman's Angels is another mentoring program that's national wide as well. Knowing your limits when you can mentor and when you cannot mentor, maybe depending on like the time in your life and what else is going on. And that's okay to be more active and then take a step back as well. That's really important to kind of think about. It doesn't have to be 24/7 because you want to make sure you maintain your own energy so you can do more. The other thing is really knowing the resources for more professional help and referrals. So if it's a formal program, or even if it's an informal program, really knowing like who's your social worker, who could you refer to? Because sometimes, as we all know, patients may need more than what you can give them in terms of psychological support, in terms of social support, and just making sure that you don't feel like you're out on your own when you're in a mentoring relationship, because these can be very overwhelming because there's a lot of vulnerable people who are going through a cancer diagnosis, which may be different than yours. And you just want to kind of, again, I'm always sort of, I want to make sure people understand how important their role is in terms of giving, but also to make sure that you're thinking about how you're protecting yourself as well. Becoming sort of a legislative policy advocate can be sort of an exciting time period as well, because there's so many different local initiatives and national and state initiatives to support screening, follow-up, support medical access to care, HPV vaccine, whether it's school-based or insurance coverage. There's a lot of different things that can be out there. Speaking to local, state, and national leaders, really using the power of your narrative from your own district to your state or national leaders is so important. And really, we've found that a lot of our legislative leaders, whether they're aldermen or state legislatures or national senators or congressmen, really do want to hear from their constituents and never forget how powerful that can be. I've listed just some acronyms here: ASCO, ACS, American Cancer Society, CANS, SGO, FWC, obviously Survivor, which may have opportunities to partner for you to share your story in these types of lobby days that can happen sometimes. This is an example of a partner of mine, Paulette, who is a Survivor school graduate, as well as a Survivor Summit graduate, and who really introduced me to Survivor and the great work that being done. And back in 2016, she actually got the state of Illinois to proclaim January as Cervical Cancer Awareness Month, which we had not had in Illinois before, and actually made a lot of our buildings in Chicago teal every year. And so different kinds of ways that people can do survivorship. It doesn't mean it has to be this dramatic and this large, but there's just examples of how small things can really make a huge difference. This was an example of what Paulette created just like locally, where she basically crocheted all of these teal and white ribbons and put information about cervical cancer awareness and screening all over the place, at the movie theater, at the grocery store, just to be able to like really share information. And this was something that she could do that did not involve having to talk to everyone, but really gave information in safe spaces. And so this was a really nice example that I always think about. Research policy and an advocate in a research venue can be very fulfilling. It's a little bit different sometimes. It's really thinking about exploring the research that's being done in cervical cancer, which can be at the level of prevention, treatment, basic science, and supportive care. And really important to have the patient perspective as expert. This can be really important for researchers to really set priorities that matter to you and matter to the cervical cancer patient community. This may require scientific training in language, research methods, or you may be somebody who already is a science teacher or a researcher or has this expertise, which may really be really important to be able to bring to the table. Advocates can do things like reviewing grants, attending local, national, and regional meetings, IRB or institutional review boards, which review new clinical trials that are being put on so that a patient perspective is this, partnering with researchers in your area or in your hospital to really understand what's being done and are they including a patient voice. This is really the way that many researchers are thinking about in terms of what grants are going to want, how we move the needle towards more patient-centered research is really done through involving more people at the table. And so I'm really, very enthusiastic about involving more patients with a cervical cancer history at this level as well. I just want to say a very big thank you for all of you who are here today. Thank you to the leaders at Survivor for inviting me to give this small presentation. And when I think about all of the incredible advocates and patients that I've known through the years, I really think about a lot of different things. The grace with which you bring yourselves to these different events, the grit that it involves going through the treatments, as well as kind of really standing up as a patient advocate, and ultimately the real generosity of time and spirit and energy that everyone who becomes an advocate in this way really brings to the cancer community. And I really, as a physician and as a provider and a friend of many patients who've had a cancer experience, I really do thank you for this, because it really does make a huge effort both at the local level and at the community level. When we see more advocates involved, we really see that the change happens in a more meaningful way. Thank you.